This is Dr. David Stoker, board-certified plastic surgeon in Marina del Rey, here to talk to you about scar therapy. Almost all of the surgical procedures I do create scars, and all day long, every day, I'm battling, number one, to plan the best location for those scars, to do a surgical procedure that creates the best looking scars, and then whatever a patient's genetic predisposition is, to follow them through to the maturation of that scar to get the very best looking final result possible. I tend to see my patients after surgery a lot, and in some cases for years, to help them get the best outcome. I find that in the procedures with larger scars, such as a full tummy tuck or a body lift operation or a breast reduction procedure where the scars can be quite long, my increased attention to detail and vigilance in monitoring and influencing those scars can lead to much better outcomes than if the patient were to just go home and come back a couple of years later. Mainstays for treatment include some type of silicone gel or silicone tape. Two products I like are Biocorneum, which is a clear scar gel that we sell here at our office. It's convenient and effective. Compliance is very high. Mepiform is a product that's sold online. It's a skin-colored silicone tape. It's, I think, very helpful and it's a product that I really like, but I find that long-term compliance is not quite as great with Mepiform as it is with the Biocorneum. Either way, the most important thing is to use one of those products pretty much 24 hours a day, 7 days a week until the pinker scars fade to a paler, mature color. Other things that we'll do in the office include little Kenalog steroid injections if a scar starts to thicken or become raised. We also have a fractional carbon dioxide laser that we use on certain precise settings to help with scars that are starting to thicken and that are not responding to the more conservative silicone gels or silicone tapes. As a last treatment for scars, and something that I rarely, fortunately, have to do, radiation treatment is available. That's more for patients who form full-on keloids. Keloids are when the scar becomes much bigger than the actual incision that was made, much bigger than, for instance, my index finger, or at least that big, when you would expect a thin pencil line there. That is something I rarely will encounter in my practice, fortunately. But for those who do have that kind of aggressive response, who are not responding to the more conservative treatments, re-excision of the scar in a very superficial radiation treatment once a day for 3 days, performed by a radiation oncologist, is a safe and effective way of greatly diminishing those scars and will solve the problem for most of that small group of patients who have really thick keloids. But again, fortunately, that's not what I encounter for the most part in my practice. Fortunately, that is rare. I hope that answers some of your questions about scar management therapy. If you have any more, I'd be happy to discuss it with you in the office. This is Dr. David Stoker, board-certified plastic surgeon in Marina del Rey.